Hey everybody, good evening. I'm Tamara Turner. It's nice to be here together. I am the academic fieldwork coordinator for our occupational therapy program here at Midwestern University in Glendale, Arizona, in the Phoenix area. And we have three great students with us today. Savannah, do you want to introduce yourself?
My name is Savannah, and I am a career at Midwestern University. They started my last to
And how about you, Meagan?
Yeah, my name is Meagan. I'm a second year OT student.
And B.
Hi, my name is Beatrice, but I go by B, and I'm a second year OT student as well.
Wonderful. So, we just wanted to get together and chat a little bit tonight with everyone about fieldwork, about Midwestern, about everybody's different experiences. We have a really robust. I'm going to pause for a second. I'm having a bad echo.
Yeah, so I'm just going to kind of take over for a second. Again, my name's Meagan Coveney. I'm a second year OT student. So B also is a second year OT student, and we both had a wonderful experience of being able to be a part of a 1A and a 1B fieldwork. So we're both going to kind of go and talk about each of our experiences, even though they're kind of the same. They both differ in drastic ways. So for me, my 1A consisted of a photo voice, and within this photo voice, we were actually able to go, personally, my group was able to go to a retirement home, and within this retirement home, we got to talk to a caregiver and the caregiver's partner who was actually diagnosed with Alzheimer's, and we got to discuss just their diagnosis and how they were as a person, and then they actually told us how being a caregiver impacted them as well, which is really crazy to kind of learn about as an incoming OT student when you don't really think about how the caregivers.
How many weeks in were you in your program? This was early in your second quarter.
This was like when you first, being an OT is taking care of the patient and just looking at the patient. I have back. Did you hear that? I might have a little echo too. But you don't really think about the caregiver's impact. You think about the patient. So that was really amazing to have that experience, and like having a partner next to you as well, being able to like work with them and you felt more comfortable. What about you, B? How was your experience as a 1A?
My experience with 1A was very, I'd say it was very interesting. It was partially emotional and partially like a great experience just because you got to see the different perspectives of the care partner and how they are going through having to be able to take care of their loved ones, and it was just a great experience to be able to be a part of that and kind of learn more about the care partners, like day-to-day living, their loved ones' day-to-day living. How can you as an OT help not only their loved ones, but also help the care partner, because it's very difficult and very challenging to be a care partner, but just to be able to be that support and that help, it was just so mind-blowing, and it's amazing.
So I have to say, well, first let me back up a little bit and say, okay, so we're talking about this very first fieldwork exposure. So there's two different kinds of fieldwork in occupational therapy. There's level 1 and level 2. And level 1 is during your didactic academic program. And So it's mixed in, you know, while you're taking other classes. And it's a shorter experience here at Midwestern. It's usually about a 30-hour experience, sometimes a little more, just kind of depending on which one it is and where we are. But I noticed that, you know, students get a little bit nervous at the beginning. So Meagan, you were talking about how, you know, here you are, you're a brand new student, you're just trying to kind of figure out what is my role as an OT. And so then, you know, we really try and design it in a way that I guess you could say like scaffolds or like really help students to feel more structured. So you were talking about how you're with a partner and you work together. And then, you know, we can do a lot of practice in class. This is how you do this interview, or these are the things that you can try and ask, or, you know, how you respond. You know, that first field work, it's so non-traditional. We're really focused on a population because, you know, and I don't know if you all know this. I know that B and Savannah and Meagan definitely know this, but with OT, you can have just, you know, the client, the person be who you're working with, but you could also have a group be your service receiver, I guess you could say, or you could have a whole population. And so we start by looking at the population as our clientele, and we choose a different population each time we run this. But the whole idea is, how do I get to know a person from this population? And then can we put all of our data together and talk about, okay, so when I work with somebody from this population, what is it that I might do differently as an occupational therapy provider? And so for this year that Meagan and B were in, we did care partners with people with dementia. And so they got to meet with different people and learn about them. Now, Meagan, you were able to go to a site and meet in their, was it in their community center or in their homes? Tell us a little bit more about that.
Yeah, so they actually allowed us to go in their home. So it was like a little apartment complex, which was really amazing just because it was like what they surround themselves with on a day-to-day life. So what was really impactful for me was when talking to the caregiver and the patient himself. They were like, yeah, he doesn't remember much, like he's in Alzheimer's, but when he's surrounded by music, like he remembers the tones, the chords, like everything about it. And he like heard, I forgot what he played. It was what are those things that go in and out? An accordion? I think it's like he was a famous accordion player. And he heard the word accordion. He shot right up, opened his accordion box, and started playing like notes, like music that you couldn't even imagine of like playing. So like for someone who has Alzheimer's and then is able to just immediately remember like all of these different music notes or whatever they're called. I'm not a musician, but he was going to town, and it was so impactful, so amazing to be able to like witness that and see like just because someone is diagnosed with Alzheimer's doesn't mean like that they're unable to do what they love.
Mm-hmm. I remember B, when you were doing this 1A, this population health experience, you were doing a virtual call with a care partner. And I think it must have been after your first call, and you had this really kind of heart to heart, like really, I mean, you're asking personal questions, you're learning about this person, what is their lived experience. And I ran into you on campus right after that, and you had the biggest grin on your face. Do you remember this? It was over by the library. You had the biggest grin on your face, and you said, Dr. Turner, I love this. I feel like an OT.
I do remember that. I think that was the first time that I felt like an actual OT, because I felt that connection between the care partner and me as an OT, being able to provide that support. And when I say it was like the most like best thing ever, like even the care partner was like emotional, and she was like, I'm sorry. I was like, no, don't apologize. And she was like, I just want to thank you guys so much. Like OT has been nothing but amazing for not only me, but for my loved one. And it was just really amazing. And that's when I realized that, yes, like this is, OT is where I want to be. Like, this is me.
Yay, yay. And you know what? I love hearing that because, it is kind of scary at first to think, oh, I'm going to go out there. I'm not even with an occupational therapist. I'm figuring out this, you know, occupational profile process and learning who a person is and how to use my therapeutic modes. And I feel like the growth that you have from going through that and really seeing, oh, this is not hard. I can talk to a person, right? And I can gather these pieces that I'm learning about in class and see things from a different light makes a big difference. So we talked about kind of 1A being that population health focus and certainly non-traditional. Our 1B, so we have 3 level 1. So our B level 1 experiences, again, about 30 to 40 hours. It's more traditional. So there we're looking more at that one-on-one therapist with a person as their clientele. And we have practice settings, inpatient, outpatient, community-based, from birth to the end of life, across the lifespan. And that opportunity is really to look and say, okay, so if I'm working with a client, what's the process here? And we have assignments that mimic the things that you've learned in class. So you're going to field work and you're thinking, okay, so I'm going to interview this person. I'm going to develop a home program for them, or I'm going to look at, okay, what is the activity they want to return to? Why can't they do it now? Maybe talk a little bit. And Savannah, tell us, where was your 1B?
So my 1B Darko Institute, and I was in their inpatient. I really loved it there. Wonderful experience. I didn't have any therapy inpatient experience at all. So I actually was with a Midwestern grad as my so I got to see so much there forward to kind of what I was really interested in as an area of practice, field works.
Yeah. Where were you, Meagan?
I was actually across the clinic at Mickey. So that was really cool. And it was just a pediatric clinic. And it's what's connected to our school. So that's really amazing that we have that opportunity to do. And I think as a third year rotation, right, Savannah, that we also have that available, I think, for third years, which is really cool. So you get to see that growth from just starting off as like your first year rotation to like having that availability to be a third one too. So that was really amazing.
That's great. And then B, you were also at a hospital. You were at Dignity in Chandler, is that right? Or Mesa?
Yeah. Yes, I was in Dignity in Chandler. So it was like kind of it's a pretty long trip, but I enjoyed it. So yes, I was at a acute care outpatient rehab. The rehab center was kind of connected to the hospital, so if anything happened, the hospital was right there. Yeah, it was more so of an acute care rehab facility.
Okay. Talk to me a little bit, and I know, this is a year ago almost, or earlier this year that you did this, but do you remember any experience where you're observing and maybe helping work with a client and you're kind of seeing the pieces from class, maybe from OT process or whatever classes you were enrolled in that applied kind of start to fall into line with each other?
Yeah.
For me, I think. Oh, you go, B.
No, go ahead.
You go. No, you go.
So,
No, you go. Okay, then Meagan.
so shadowing or doing my field work at the acute care rehab was definitely a learning experience, just because I had an OT instructor that actually specialized in vision. She was a vision rehab specialist. which I didn't know that OTs could do that. So I was really, really amazed by that. And just being able to learn about the different tracking assessments that you had to assess on clients, and doing certain movements, applying muscle manual testing. It was just really a good experience. And then like learning some intentional relationships, so like collaborating with the clients, and building encouragement, and just having so much patience with the clients was very helpful. I got to had the opportunity to be able to kind of work with the clients here and there. So it was really a great experience to be able to have some kind of like a little bit of hands-on experience whilst being there and applying it, not only there but also whenever we have classes. So it was a really good experience.
How about you, Meagan?
Yeah, so mine was with kids. So I never saw myself as like being a pediatric OT. So it was definitely very different. And I was very aware of like the different therapeutic modes that we've worked on in class and being able to transition those into the therapy sessions. So when working with kids, it was very evident of first being happy and cheerful and bright, and then okay, it's therapy session, it's time to like okay, put that away, and now I know we're having fun, but we're actually doing like therapy and we're working together, and this isn't just like a fun time, but we're actually like going for like a common ground. So that was really interesting and very like evident again of me to like notice how I use them in different ways.
Yeah,
My dog
that's great.
barking. I'm gonna open.
Well, I will say that as OTs, we like to be inclusive of all people, including dogs, right? What's your dog's name?
This is Wrigley.
Wrigley, welcome. Welcome to our chat.
Yes,
if you have anything to chime in, let us know.
Yes, just keeps knocking.
That's great. That's funny. Yeah. So, yeah, okay. So we talked about 1A, we talked about 1B, and then we have a third rotation, 1C. And I can't, it's hard for me to say which is my favorite because I really love all of them. But I love the way we do 1C. Now we're looking at that third clientele, a group. So now if we run group sessions, work with a group of people on a common goal, what does that look like? How is that different than one-on-one services, or even looking at a population as a whole? They're all such a different service delivery method. So Bea and Meagan, you guys are about to go out and start this. But Savannah, you had just a really great experience. Maybe talk a little bit about that. I'll say first, though, that the purpose of this one, like I said, is to kind of see what groups look like, but also to give back in the community. So we really work hard to develop relationships with sites that can benefit from our OT students being out there. So, they're doing a lot of service and really helping build relationships with the sites and helping show what OTs can do and what kinds of services we can provide. But it's not that I'm going to follow you and learn from you type of setting. It's like, okay, here's what I see. Here's an idea. Let's try that. So Savannah, you were at a group home that housed 4, I think, adult women that had grown up with developmental or physical disabilities. And maybe tell us a little bit more about that.
Yes, so Dr. Turner knows I absolutely loved my 1C. I could talk about it all day, so I'll keep it concise right now. You summed it up perfectly, Dr. Turner. We got to work alongside, collaborate with the residents, the women that lived in the home that we were at, and the staff that worked with them to make modifications to their home, to make it better for them to be able to access their daily like basic ADLs, whether that's getting themselves ready in the morning through brushing their teeth, going to the restroom, as well as things they love to do. One of our clients utilized a power wheelchair. She had a diagnosis of CP. And so we made it to where she was able to access her closet. She was quite the fashionista, and she fashion was her favorite ADL and occupation. So we worked with her on helping her access her closet. And so we got to make some modifications throughout their house, as well as helping them be able to access their gardening area. Several of the women love to meal prep for the week. And so we just worked with them, came alongside them and their staff to promote them to be able to be as independent as possible in the things that they wanted to do. So it was an amazing experience.
It was really fun to hear the stories. I got to come out and see Savannah and her partner at the site and meet the women that they were working with. And you could just see that they built such a great relationship. Okay, now, so Savannah, did anybody say, okay, Savannah, you're going to this place and these are the tasks that they're going to need you to do, so study up on X, Y, and Z?
No, that's such, I was thinking when I was reflecting on 1C, I really love the way our program sets us up, the way you kind of were talking earlier, Dr. Turner, about how you have 1A where you're kind of getting out there and working on the skills of building an occupational profile and building rapport. You step into 1B where you're learning maybe more directly from a currently practicing practitioner. And then 1C is not structured at all in that way. So that was the part I guess I should have started out with, that we went to Laura's house without any OT services already present. None of the women there were receiving it within the home or outside of the home. And so that was really challenging. And we were able to draw on our 1A and our 1B experiences and really be able to blossom in our 1C experience and have to kind of put everything into practice together. And that was really challenging, but really rewarding by the end, because you kind of saw yourself grow little by little throughout the process. So that was a really, really good experience.
Yeah. I like I said, favorites are hard, but I love the 1A, that initial growth. Like I said, when I saw B on campus and it's like, yay, I feel like an OT. That's just so great. But the 1C, it's almost like you've become who you are as a practitioner, and you certainly don't know everything. You haven't gone out on any of your long level 2s, but you can say, oh, I know how to look at this situation and think about what, with my specialized training that slipped in there over the last year and a half, I can look at this and say, oh, if we make this little adjustment, then you're going to be more independent, or you're going to have more life satisfaction, or whatever the situation might be. So, so that was one example of this group home, but we also have these they're called role emerging placements, because there's no OT program established at the site, or at least where the student is assigned to be working. So we have had students go to a foster program where they're working and providing support services to people in foster care. We have students going to a ranch or a barn where they do hippotherapy with horses, and they do therapeutic riding. We've had students go to a gymnastics place where children are there with typical development and with atypical development, and then the students are looking and comparing that and saying, okay, what would the role of an OT be here? And the reason we do this placement is because I really believe that it makes you see yourself and your surroundings in a different way. So Savannah, you've done a level 2 placement now, and so you might be able to chime in on this, but I think that instead of going out into the workforce and saying, okay, I work here 40 hours a week, and I'm going to do my 8 hours today, and I'm going to see my X number of patients, I'm going to document, and then I'm going to clock out and go home. You do all those things, but you're also noticing kind of a bigger picture of what's going on. And you become kind of like almost this piece of the team that the whole facility or institution couldn't do without?
I definitely feel like both all of my level ones, but especially 2A. I heard someone say that being a student and being in a fieldwork is like holding up a mirror to yourself, and you learn so much about who you are, like you said, Dr. Turner, and you learn so much about how you're interacting with patients, and it's very humbling, and it's also so rewarding in the end. It's tough along the way, but 2A was very challenging in that way for sure. But you really are emerging out of your shell a little bit more. And like you said, I think my CI had said to me, there's so much beauty in taking in a student after practicing, because it takes you back to the basics, and it also does open your eyes to maybe something like maybe a pattern you'd gotten into or routine you'd gotten into. And so that was really cool just for my experience as a whole.
Yeah. So listen to all this growth that these 3 students have shared already. And this is just like that little level 1. We're talking about like 90 hours of experience, which is nothing in the long span of things. And, they're just such great learning opportunities. At the end of the didactic program is when we have the level 2 rotations. And the level 2s, the way we do it at Midwestern is we have 2 level 2s, and they're both 12 weeks, and they're full-time, and you're out in the field, and they're in 2 different settings in one way or another, so that you're getting some variety. And the whole point there is then really to become an entry-level practitioner in that particular practice setting. So maybe, Savannah, I know you shared a little bit, but maybe share a little bit more what things were hard about starting a level 2, what things made it easier, any advice that you have for Meagan and B, who are going to be there before they know it.
Oh gosh. Yes. So I really loved my setting. I was in adult acute care, and I have had a ton of clinical experience in acute care setting, but not any therapy experience. So I was learning so much right off of the bat. And I think there's this expectation on yourself that we put on ourselves as students I have to know every single thing and be on top of my game 24/7. And the reality is that we really don't know anything, right? And so we know a lot. We're really smart and we've worked really hard, but you know what I mean? I'm not a practitioner, and so yet. And so that is really hard to kind of give yourself grace in those moments of, oh gosh, I don't remember this, or, oh, I don't know what this looks like outside of a textbook. So I think those are some challenges that come along with really actually getting out there into 2A. And then just the pace of it all, it's so different from the classroom, but in a good way. It's great. But I think my advice to B and Meagan or any student is just giving yourself grace, and being super open to feedback is so helpful. Because it can be really hard to receive feedback because we're already being so critical on ourselves, but there's so much value to gain from receiving that feedback and constantly asking for it, and just being in a position of refinement and not, oh, I'm doing terrible and these are all things that are being corrected, but more so like I'm refining my practice and the practitioner that I want to be in the future.
So well worded, because it's really it is just what you said. Nobody expects you to be an expert. We just want you to grow from wherever you are, right? And so instead of thinking, oh, this is what I don't know, you have to really think about, this is what I do know. What can I add to that? What else can I look at? What else can I see? So that's great advice. Some changes that are coming, not this year, but the following, we're going to be adding more level 1 rotations so that students get more exposure to different kinds of sites. So instead of having one traditional rotation, they'll have more than that, be able to see OT in different settings. And, with the level 2s, it's still going to be 24 weeks of level 2 field work, but there is a little more flexibility to maybe do like a shorter one and a longer one, or we're playing with those ideas, but we really work hard to make the fieldwork program meet the needs of the students, the needs of the sites, and not just those like outward needs, but the ones that really inside help you become who you need to become as a future practitioner. So I'm going to switch gears a little bit because I was thinking about OT school and kind of what that experience is like. It's so different from, your undergrad. It's no matter where you went, even if you had a smaller school, it's just, you're in this cohort, you're going through all your classes together. And we have this course called Teaching and Learning, and we talk about pedagogy, which is a big fancy word for like the way that we teach and kind of what our values are. And with OT, we have 3 focuses, and one of those is relational learning. And I think Midwestern, especially, all OT is good at this, but I think we are really good at this in that we want to know each of our students, and that helps us be better teachers, and it helps you be better students. Do you guys want to comment on that a little bit? B.
Been put on the spot, but yeah, I think
how has knowing, let me ask you a more specific question. How has knowing your instructors, your teachers helped you in the classroom?
I think it's helped me in so many aspects of being in Midwestern. I am originally an out-of-state student. I'm not from Arizona, so coming to a new state, new environment, different people can be very overwhelming. Sometimes you do kind of get homesick. So attending Midwestern and being around faculty and staff has made me feel very welcoming. It's made me feel like I'm home. They've made me feel as if like they're like family in a way. If you need anything, they're there. What I like about the our faculty and staff at Midwestern is that they have an open door policy, and I love that they have an open door policy because not all like universities have that, and so for them to have that in their facility just makes it 10 times easier for students to be able to be comfortable enough to go and talk to them about any situation that they could be facing, questions they might have, whether that be personal, whether that be financial, whether that be academic. They're so welcoming that you just feel like belonged, and I just love that they have the compassion for students, because you don't get that again at every school. So to have faculties and staff that really care about students is what makes me love Midwestern and even our OT program in general. So
Thanks. Yeah. I appreciate your examples just because it's true. When you see open door policy, I've worked places where it's an open door policy and you go in and say, "Hey, can I pop in?" And they say, "Well, I have a minute, and can you make it quick?" And I get why, because people have a lot on their plates. But we really do say, like, come in, or like message me on Teams. You pop right in and we figure out, okay, this is when we can meet, and yeah, let's make time to touch base. That's an important piece, and I think it's nice that we can get to know each other. I mean, yeah, I'm Dr. Turner, but I'm Tamara, right? we're colleagues in the making here. We really want to be supportive of each other and just understand, kind of who everyone is, for sure.
I think we as students, we get afraid to go in and like want to talk to the professors because we're just like, I don't know what they're gonna do, but they encourage, they definitely encourage students to definitely come and ask questions. And even Savannah can be my witness. Like when I first came here, she was like, don't be afraid to go talk to your professors. They're there to help. I was just the same way. I promise they are there to help. And at first I was like, okay, I guess. And then when I did start doing that, I was like, she was right. They are there to help in every way. So.
Yeah, that's good. Another one of our signature pedagogies is active learning. And so maybe Savannah, talk a little bit about active learning and how you've seen that play out and help you. I mean, do you love sitting in lecture? Do you felt like most of your OT was lecture, or talk to me a little bit about
I love that you asked me this because I benefit so much from like practicals. And now practicals scare me, don't get me wrong, when I first started, but I recognize that that type of learning is so helpful to me. I really benefit our neuro rehab class as well as several others. That's just the first one that comes to mind. Our neuro rehab classes, really, we have a lecture and then we also have a lab, and that is so valuable. I'm a kinesthetic learner with a little bit of visual, so maybe a little multimodal, but I definitely benefit from active learning, putting what I'm learning on the board or on my laptop into practice. It definitely helps with transference of knowledge and understanding of the content.
Yeah. I feel like we work really hard to be, and it's not just, okay, we have labs, so that's active learning, but we want you to get up and move your body, and we might lecture a little and then say, okay, now let's practice this at your table. Whether it's interviewing each other or measuring, inflammation or whatever the task is, we're trying to switch it up and really be active. And I think that marries really well with field work in that we want you to get these hands-on experiences. All right, so then our third signature pedagogy, to have those fancy words, is affective learning, which is that piece where it matters to you. So Meagan, maybe talk a little bit, what's something you learned in OT school that you were like, oh, I see it differently now? And if I can give you a couple ideas because I'm putting you on the spot a little bit, but
I think just going kind of reversing back to that 1C where it was like, we don't think about the caregivers or the people who are like around the patients that we're looking at. I think Midwestern did a really good job of taking the holistic approach and not just looking at the person's diagnosis, but them as a whole. So I think for me, that was something that was really like, that affected me in that way. If that makes sense.
Yeah, definitely.
Okay.
Savannah, you look like you have something to add.
I do. I was thinking about in lecture in our I can't remember which class it was in, but we just talked about different things. One of the ones that comes to mind is utilizing person first language. And so that looks like looking at what a patient with a diagnosis or differing ability, do they what is their preference in how they are addressed, and not identifying someone based on their unique need or their disability, instead identifying them as who they are, not putting someone into a box because of the needs that they have. And so that was really something I had never really considered, that's something I should collaborate with a patient to find out kind of what's best for them.
Mm-hmm. Yeah. I think, becoming an OT kind of changes your perspective. And, how you said about refining, it's that becoming, it's that process of growth that kind of helps us change. I love going to the AOTA, the American Occupational Therapy Association conferences, and they always have a keynote speaker. And, it just kind of helps you think about it in a little bit of a different way. So if you ever want something to browse around on YouTube, search those AOTA keynote speakers, because everyone brings a different perspective. And you always come away thinking, oh, yeah, okay, and kind of refocusing in this way or opening your eyes in that way. So, OT is a great field, that's for sure. Okay, so I want to have a better picture here, though. So you guys seem like perfect students. You must just like live at school and go home to sleep and come back in the morning and study all day. How else could you know all this? Is that correct?
Yeah.
He says yes.
You can say that.
Savannah, what was your day to day? Like, let's say you're kind of in your groove, maybe like quarter 3 or 4 or 5.
So I would say I'm thinking about like what really helped me day to day, like get into a routine. And first, I would say that I really met some of the greatest people in my cohort. I mean, my entire cohort is amazing and very supportive, and I just really found a lot of value in that. But as far as my routines, I think it's really important to take care of yourself in whatever that looks like. But what it looked like for me was finding a time to move my body, to feel good, to exercise, and to kind of plan my week ahead in advance. And then taking some time for myself to explore Phoenix. We have a beautiful city here, explore with friends, and, really just kind of have a good balance of, really hitting the books and hitting the content and learning it and then trying to apply it, but also taking care of myself so I could do that to the best of my ability. So
that's great. Meagan, how about you? Are you all study, no play?
I'll study, no play. No, I'm actually from here, but that makes it even more like very difficult for me, just because my home is 45 minutes away from campus. So after a really, really long day, you have another drive home, and then you have to like study again and get on a routine, and then go to bed early because you have to wake up earlier to drive to school because it's again 45 minutes away. So just like Savannah said, establishing a routine that's like predictable for you, I think is extremely helpful. If you're a person who likes to work out, like go in the morning, because I found, at least for myself, after a really, really long day, getting home and finding that motivation is extremely difficult. And just staying active. Again, Midwestern offers so many sports or activities, which is extremely fun to like stay connected with your cohort. I was able to do soccer. A few of us did volleyball that some people got to see. So that was really fun, and it gets you connected with your cohort and really gains a strong mentality with each other, because you aren't just study partners, like that's your family for the next 2 years. So just being able to branch out and not just use them as a tool, but also like a friendship too.
Yeah. I like that. I was an OTA, and then I had some advice given to me when I was in my undergrad that it would be great to go to OTA school, become an occupational therapy assistant, and then I could work while I was getting my OT degree. But I fell in love with working with the clients, and I was an OTA for 10 years before I went back and got my master's, even though that was my original plan, And if you asked me what the best thing about OT school was, yes, I had a great education. I had a great program. I learned a lot, but it was really those relationships. It's lifelong relationships. Still in touch with a lot of my friends, and seeing people's updates and hearing the great things that they're doing in the world. It's just so fun and rewarding. And really, like you said, you're together and you make these bonds.
And what you were saying too, it's like staying connected. OT is such a small world. Like you run into so many people. Like I can already tell with all of our teachers, they come in and they're like, yeah, we've seen you in practice this many times, which is just really, really amazing to see.
Yeah, that's right.
I know for me personally, uh, things that I like to do with some of my friends, like either between classes. So like after classes, we'll like go. We have lunch breaks, so we'll probably like go to the cafeteria and grab something to eat and just sit down and kind of like relax and just get our minds off of like schoolwork and assignments that may be due and kind of just talk about like maybe our weekend or our day or what we have planned for the next break that's coming up and stuff. And so I'll do that. Or whenever breaks do come, I try to go out and do things like go hiking, which I haven't gone hiking in a while. I need to go back, but
It is summer.
yes.
Yeah.
Yes.
Yes, when it cools down, I'll go back. But usually in the fall, I usually will go hiking, and it's just amazing to go out into nature, or go on walks if I can at night, or just to do things with people that are you're surrounded by, and kind of just like take the ease off of whatever you're going through um, in your life. So yeah.
That's great. Thank you for sharing that. How about is there anything else you guys want to chat about when we have time here together?
Dr. Turner, I wanted to ask you, I know you were kind of just giving us like an overview of your transition throughout the discipline of OT. And each of our professors, for anyone that's listening, have specialty areas. And I really would love to hear a little bit about your specialty area, Dr. Turner, of dementia care,
Oh,
and kind
yeah.
of what sparked your passion to jump into that area of practice.
Oh, yeah, sure. So I have always worked in adult practice. As a teenager, I did a lot of service in older adult areas. And so I felt very comfortable in that area of practice, building relationships with people, hearing their stories and things like that, how to approach a person. I remember, I think we were, I don't know, 12 or 13, and we went with our church group to, it must have been a nursing facility. And the person that was overseeing us taught us how to talk to a person, like, don't come up from behind, get down at their level. And so those are things that, I had practiced a lot, and I felt kind of, I don't know, just very comfortable in. And so after graduation, those were the areas of practice I always worked in: acute rehab hospital, outpatient neuro, skilled nursing, which is another inpatient rehab. And then as I started teaching, I transitioned to doing home health because that let me keep my hands in the practice area and still keep meeting people and working with them and getting, it is kind of maybe selfish a little bit, but I love the intrinsic rewards that you get from seeing somebody meet their goals, and really that you've made a difference in their life. That if they didn't have your services, it wouldn't be the same. So that was always very rewarding for me. But in 2018, so I graduated from OTA school in 01, and then from OT school in 2010, just to kind of give you like an idea of how far into my practice I was. But in 2018, I was invited to apply to the Hospice of the Valley Dementia Care Fellowship, which was, and I did get that fellowship. And it was just such an amazing experience. It was a year-long process with, a select few people from all around different practice areas, but that worked with people with dementia. And the idea was that during that year, we would look at a way that we could institute change for people with dementia, and lots of different ideas. One of the gentlemen was in public service and like a first responder. And so he did a whole thing on educating his team so that they would better know how to work with somebody with dementia if they found them in whatever emergency situation it was. Another person was a social worker, and her project was doing improv comedy strategies to improve communication with people with dementia, so that you can kind of roll with the punches and not worry so much about if somebody says something either off the wall or wrong. It doesn't matter. We can just roll with it and kind of figure out what is it that their intent was, where did that come from. And those are just some examples, but my project was about developing a curriculum for teaching dementia in our program, and then also being able to share that knowledge in the community. And just through that process, my love for dementia care grew. I certainly had worked with a lot of people with dementia. It was not my specialty area. My embarrassing story is it stands out in my mind early on. But after I was an OT. So early on, after I was an OT, I remember working with a client that had a hip fracture. That's why she was getting therapy services. It was in a inpatient rehab facility. And she was, really pretty far along in her cognitive decline. And I did not know how to work with her if we weren't doing something natural in the environment, which is your best practice, right? So if we're going to work on showering or dressing or those skills, then we should do it in that person's routine, what makes sense to them. So we did do some of that. But if I had her scheduled at a time that wasn't natural, for whatever reason, it just was so difficult. And I remember tossing a beach ball to her. I've probably told you this story. Tossing a beach ball to her, and she would throw her arms up to protect herself to get it away. And this is me now, right? I know she was just protecting herself, and I was putting her in fight or flight and freeze, all of those pieces, right? And I was at that time thinking, okay, good, I'm getting participation. She's moving, she's doing something with me, right? I had so much to learn for those more severe cases. And I think because of those experiences, or that one especially, I feel like I'm more passionate about it. I don't want my students to go out there and have those experiences where they're like, I just don't know what to do. And there are going to be experiences that you have that you don't know what to do. But let me share my learning with you, so you don't have to make those same mistakes, right? So I think that's how my specialty area kind of developed, if that answered your question. I started a small business where I see clients in the community that have dementia, work with them, with their care partners, helping them to maintain or improve their quality of life, depending on where they're at. I've worked with people in their homes or at the library or at the grocery store, with the idea, sometimes, and Meagan, you alluded to this earlier, but sometimes you think, oh, this person has dementia, so they can no longer do anything, right? Or they just sit there, or I don't know, I'm making up different things. But really, it's like, okay, yeah, so maybe it's hard to go grocery shopping because of the cognitive changes I'm having, but it's not all or nothing. Can I go in the middle of the day when it's less crowded? Can I hand a note to the cashier that says, I have cognitive challenges, speak slowly? Or don't talk to me while I'm paying because I get flustered, or whatever. There's just so many different strategies that you can practice and try. And so that's something that I really love, and I feel like makes a difference. My passion area is really to work with people earlier in the process to help them make the choices that they want to make and make changes, and help their families learn how to support them through this process, so that it can be kind of more of a graceful flow with something that is so hard, to lose your cognitive abilities. And it's such a gradual process. It's very hard to live through, and it's hard to watch somebody you love go through that. And so I do love figuring out ways to make that process go better. Actually, I don't know if you can tell if you look closely, but my hands are covered in ink because today I did a training using art for people with dementia to help them with their quality of life and mood and pieces like that. And it's all about, how do you help them be successful by only giving the supplies that you need one step at a time, rather than all the things that could be overwhelming, and only providing, I'm not an artist, but I'm learning color theory, right? So how do you give the colors that will complement each other, let that dry, and then give the contrasting color that then becomes a spark, you know, and it's so great. I feel like there's always more to learn, but I will tell you, look, I'll show you. I don't know if you'll be able to see, but like this is some of the art that is done, and just the rewards that people have from that. But anyway, I could go on and on about that. I probably answered more and more than what you were looking for, Savannah. But it's true. We all have our different passion areas, and there's so many of us here that literally you could go from office to office and talk to each of us and hear totally different experiences from our practice. And if there's something you're interested, there's someone to talk to about that.
Well, Dr. Turner, I want to quickly ask you about yourself as a person. Where did you grow up, and how was your childhood and your young adulthood like?
Oh yeah, sure. So I was born in Utah, but I grew up in San Diego. Both of my parents were from California, and both sets of grandparents lived there. And so, you know, that's where I grew up, and just in El Cajon, which is East County, San Diego. And you know, I'm the oldest of 5 kids, and what else? I was in choir. I'm not very athletic. You know, if I throw a ball, I go like this. And of course, now I have 3 kids, and I've passed that on to them. You know, ball aversion. Except for Andrew, my youngest, he's like, I love soccer, and I'm going to go out and play soccer. So, yeah. But you know, I'm crafty. I'm not an artist, but I'm crafty. I like to do different types of crafts, scrapbooking and sewing quilts or whatever, different things like that. So you can catch me doing those things when I have time to do it. But my favorite occupations, so to speak, are doing what we call co-occupations, right? But spending time with my kids, doing things together. Don't like to cook, but if I'm doing it with one of my children, then it's like I really enjoy that process. So but we probably could keep talking all night. It's been a great night so far, but I do want to make sure to have some time in case there's any questions out from the audience. Hi, I'm Chrissy. I'm curious to hear what the students wish they would have known before starting OT school and what has surprised them about the occupational therapy profession. Oh, that's great. Savannah, do you want to take this one?
Yes, I would love to. This is such a good question. I came into OT school very narrow-minded that I was going to be a pediatric occupational therapist. I was going to work in the outpatient setting. And that was it. That's what I wanted to do. And so before, some advice I'd gotten was to, go with an open mind. I was like, sure, I'll go with an open mind, really still very narrow-minded. And I am glad that I really pushed myself to be more open-minded in learning about different areas of practice. I had no idea you think you have an idea of everything OT can, encompass, but it's so much and it's so wonderful. And so I think that would be probably the most surprising, which should have been more obvious, I guess, knowing what I know now about OT. But it wasn't to me at the time. And I think that's what the best thing advice I had gotten before starting OT school was to go in with an open mind, because there's so many things that you can do, and really using your individual gifts to find where you want to practice.
Meagan, do you have any advice?
I think just piggybacking off of that, I really had no idea how many different areas OT can actually go into. I came into OT knowing that I did not want to go into the hospital setting. I wasn't the best working with kids, but going into the 1B, I got that experience and I realized I was good at it. So that was really good to know. So that opened up new doors for me. But this school in general just really does open up all of those doors, and you get to experience all of these different areas of occupation that you don't know going into it. But that's for me. What about?
How about you, B?
It's the same thing for just like Meagan and Savannah said. I came into the OT program thinking like peds. Everybody comes in, and then a lot of us are like, peds is what we're doing. And then I was told as well to have an open mind, and I was like, yeah, sure, open mind. And then I got to my first level 1 B, and I was like, wow, I think I'm starting to love vision. And then I was like, I think I like acute. And then I was like, I think I like dementia just a little bit. And then I was like, I don't know what I want to do. But I'm kind of in between the perspective of either still, I mean, you can still do all. Like OT is so broad that you don't have to do or be in one specific setting. You can do so much, and that's one thing I just love about OT is that it's so broad. You can do all if you want to, just not only one.
Yes. It sounds like there's a theme here.
Yes.
Don't be surprised if your ideas change. You know,
Yes.
have your heart set on whatever you want, but you're going to see all sorts of things that then your heart is going to be like, oh, I like that too. That's great. Okay. I'm very drawn to non-traditional settings and hope to work with trauma survivors. Ooh, do any of your current students have a similar interest that they're pursuing? Thank you so much for that question. That is great. We have a professor that specializes in trauma. And so she actually has taken some students that have, asked and have interest, like you said, and had them work with her a little bit. We haven't done that as a level 1C, mostly because it's such a sensitive area and it's hard to have students in that area. Unless, I mean, I think there could be ways if there's already an established group, then that would be an appropriate way to make that work. But we should pursue it. We should figure that out and make those opportunities. But reach out to us and I can put you in touch with that professor I'm talking about. And you could even start to learn about that now. Yeah.
Mental health is actually a fascinating setting. I actually enjoy mental health. I actually am thinking of wanting to go into mental health and working with kids that are having some challenges with mental health. So it definitely, Midwestern has some great faculties and staff that are specialized or that are more knowledgeable in that area and in that field that will help you to get to those certain settings that you're wanting to get into. So.
Yeah, and our foundation as a profession was in mental health, and then we kind of got really kind of medical model, and now it's like, wait a minute, let's be all inclusive here. Let's look at the whole picture, and there is a lot of room for growth in mental health and a lot of opportunity available.
Yeah, and just to piggyback off of them saying the non-traditional setting, because I feel like that's definitely me where I'm like, I don't want to go into the traditional setting of occupational therapy. And I've been very open with all of the teachers and they really take advantage of that open door policy. I'm in like their classrooms every day, like saying, okay, what can I do? What else is available? What can I pursue? And they're extremely helpful with like just sitting you down and like talking things through with you and opening up those doors for you. Like, okay, let's email this guy. Let's talk to this group. Let's talk to this company. And just to like get you connected within those non-traditional settings, which I found really helpful.
Yep. Sometimes we can turn it into fieldwork. Sometimes we turn it into a connection. I mean, you just never know which door is going to open which way. And it's exciting to see those things unfold. I'll say in Meagan's case, she's very interested in like adaptive sports or, maybe like Special Olympics or kind of up that alley. There's so many different areas. But one day, and I don't know if you know this or not, Meagan, but another faculty and I were here in the office just totally creating a whole like life plan for you. Oh, if she did this and then that, and then she could create this whole thing. And, we're like, okay, well, we don't have OTs involved with Special Olympics in the school district, and this is how we could make that happen. And, we really are always thinking, okay, how do we help our students become who they want to be?
It is amazing, and it's so evident in your guys' teaching practice and how you talk to us and communicate with us, not as students, but as like co-peers with you guys as well.
And I will say that for Dr. Turner, especially with fieldwork, like if there's something that you're really passionate about, she's going to ask you, so what makes you so passionate about that? So tell me more about it. And I remember in her office one day, I was like, I really want to go into the NICU. I want to work in the NICU. I do. Like, I was like, can you give me like a setting that I can work with for my field work too? And she was like, okay, so tell me why you are interested in the NICU. Why are you so passionate about it? And I was telling her like my passion about it and why I want to do it. She's like, okay, I see. I like that. She's like, okay, we're going to see. I can see if I can, find some places. And, she digged into it and found some places and was able to find like some settings that I can be able to like, get that experience and pursue that passion that that I'm wanting to like chase for. And so you're definitely gonna have this for any student, but if at Midwestern, you're definitely gonna have faculties and staff like Dr. Turner that are in the fieldwork portion, and will help you to get to where you want to be, or what setting you're passionate about being. So, yeah.
Well, we do care. That's for sure. Well, this has been an evening answering all your fieldwork questions and more. Thank you so much for being here. Both Savannah and Meagan and B, but in addition, everybody out there in cyberspace enjoying this. We love occupational therapy. We're passionate about it. We'll talk about it any day. Have a good night.
Bye.